So now that we have checked our patient for breathing and breathing quality, now we're going to move on to C, which is circulation, page 4 of my book. We're going to check the patient for a pulse. And so we're going to take the tips of our fingers and we're going to find the patient's pulse in their wrist. We'll find the patient's wrist bone, and then we'll simply move down to this notch and we'll find the pulse. There's my pulse. And we're just simply checking for a pulse here. We want to check here in the arm, because if we're getting a pulse all the way out here to the arm and we can feel that, that gives us an indication that the patient has relatively good blood pressure. The other thing that we want to do is we want to check for circulating out. And our patient is laying on the ground, and while we didn't see any bleeding when we first walked up on the patient, that doesn't mean that the patient is bleeding in an area that we can't see. So what we want to do is we want to take our gloved hand and we want to put it between the patient's body and the ground. So we'll tell our patient, I'm going to take my gloved hand, I'm going to place it underneath your head, I'm just going to check you for bleeding, pull it out and take a look at your hand and look for bleeding. And then underneath the patient's neck, underneath the patient's shoulder, underneath the patient's back, we're going to go all the way around the patient checking for bleeding. At any time we find any sign of bleeding, what we're going to want to do is we're going to want to log roll our patient onto their side, and we want to check to see where that bleeding's coming from. If we see bleeding, possible life threat, we're going to want to take care of that bleeding, treat that bleeding right away.